Okay, let's begin.
All right, ma'am.
It's a communication skill, so you can decide, both of you, who will do which one.
I can
Okay.
do. Aisha, what do you want to do? It's your call.
That's fine. I will do history taking then.
Acha, okay, then let's go then. Inshallah.
All right. Okay. Starting the timer, and here is your question.
All right, ma'am.
Right. If you have read and understood, kindly begin your station.
Hello, good morning. I'm Dr. Ulfa Jahan. I'm one of the examination candidates. Can I please confirm your name and date of birth? Hello? Hello.
Hello. Yeah, hello. I'm Aisha. Hello.
Yes. Hello, Mr. Aisha. Nice to meet you. So I've been asked to speak to you regarding a medication that you're supposed to,
Oi,
which is called
someone is going through the notes.
warfarin. So if you could tell me, I understand that you've been scheduled an operation for your hernia, and you've been asked to stop warfarin that you're taking for a long time. So can you please tell me, what do you know so far about this medication and what is worrying you most?
Yeah, doctor. Up till now, my heart doctor has told me that it's this medication is so much important for me, and it is required for working of my heart and to prevent the clot formation in my blood. So I have to take this medication for rest of my life, and that's important for me.
Yes, you're absolutely right. Yes, whatever you are aware of is quite right. However, let me first explain to you what warfarin is and why you have been prescribed. So basically, warfarin is a medication that thins your blood, right? And you have been given this because you have a mechanical heart valve replaced, right? And what happens is, patients like yourself who has a mechanical heart valves tend to have a higher tendency to develop clot. That means blood clots, which could cause various heart problems. So we give this blood thinner, the warfarin, to keep the blood thin and prevent this clotting. Now what happens is, you have been scheduled to undergo an operation, and since it is an operation, so that means there is going to be a lot of bleeding. So, and since you're already going to be taking warfarin, so it will stay in your blood and there's going to be a lot more bleeding. So to prevent all of this, what we surgeons do is we usually stop this warfarin that you're taking. However, because warfarin is such an important drug, a medication, we do not stop it. Instead, we give a substitute for it, so that you are not left unprotected. And what we do is we give another medication, which is known as the heparin, and we give this medication through a vein on the back of your hand through an injection. Yeah, so we give that, and you must stay here. And the main purpose of giving this medication is that we can stop it just prior to your operation, like perhaps 12 hours before your operation, and after your operation is successfully done, we can again restart this medication, and then later on, after doing some blood test, we can again get back to your warfarin. Yes, are you understanding what I'm trying to tell you?
Doctor, I actually can't get agree to your decision regarding my medication, because my heart doctor has told me that I can't stop this medication, and I have to care. Why you can't continue with my medication and do the surgery? Why you want to change it? I'm so scared about that.
Of course, I do understand your apprehension, and this is a very excellent question you've asked me. The thing is that the warfarin, it has a long duration of action. This medication, and it stays in your body for a long period of time. Yes, even after we have stopped it, like 5 days or so. Whereas the other medication that I have said, the heparin, it only stays around 12 hours, and we have to continuously give it to you every other day. Yeah, and so because of its short duration of action, what we do is we stop it before the operation, and we can have a very smooth and less chance of bleeding, a blood free operation. And after that, again, we can start with the heparin, and then after doing some blood tests, we can do we can restart your warfarin. Are you following me?
Yeah, doctor, but will I be protected throughout this period?
Yes, they both have the same function. Basically, they're just an alternate to each other. That's all.
Okay, and when can I start taking my medication again?
All right. So what we'll do is we'll need you to get admitted 5 days prior to the operation date, and we're going to stop your warfarin, and we're going to start with your heparin, and we're going to monitor you to see if there is any problems, and then we're going to do some blood tests. 12 hours before your operation, we're going to stop the heparin that we're going to give you through the back of your hand. And then we're going to, after the operation is over successfully, the next day, after that, we're going to start with your heparin, and we're going to do a blood test, which is called the INR. If we see that this INR is within the desired range, then we will start your warfarin as soon as you are given food in the mouth, orally. Yeah.
Okay, doctor. And doctor, I'm also taking some antidepressants. Can I continue taking that before my surgery?
Yes, sure, no problem. You can continue taking those medications, and you can continue taking the medications. And I would suggest you that since the day of your morning, you might be not having anything per mouth, so you could just take that with a few sips of water. That'll suffice.
Okay, thank you so much,
Yes.
doctor.
All right, so Mr. Aisha, if I could just summarize to you. So I have explained to you why we will stop the warfarin for you, even though it is protective for your heart. But we're not going to leave you unprotected. We're going to give you another drug, which is called the heparin, and we're going to give it through the back of your hands. And it has a shorter duration of action, like around 12 hours prior to your operation. We're going to stop it, and we're going to monitor you. And after your operation is successfully done, we're going to again resume this heparin, and once you are allowed to have food by mouth, we're going to start your warfarin. Yes, and we'd suggest you that you get admitted 5 days approximately prior to your operation, so that we could continuously monitor you. Yes, do you follow me?
Yeah, doctor, I follow you. Thank you so much.
Yes.
All right,
And
thank you so
not
much for
stop
your time.
diazepam. You should not stop your diazepam tablets.
And you should not stop your
Until
diazepam tablet.
Yeah,
Yes, thank you.
until the morning of surgery, but only with a small sip of water. That
Yes, ma'am.
instruction as well. Yeah, because
Yes,
you
ma'am.
still have 40 seconds. That's why.
Oh, I still have 40 seconds. Okay, now.
Yeah, very good. You covered everything within time, but
Ma'am,
yeah.
sorry, I stumbled a lot.
That's okay, because you didn't know. That's when learning takes place. You did not know which station you are going to have. It was
And I
totally
called
surprise, and you
Aisha,
took it.
Mr. Aisha. I'm
That's
sorry.
all right, because it was supposed to be a male patient. Excellent. You're because the
Thank you so
communication
much,
skill
ma'am.
doesn't matter. You don't have to change the gender. I didn't give you the name of the patient, so whatever name you got, it had to be the male. And then the way you consult now went okay. So the
Yes,
way
ma'am.
you have consulted your patient, and you have tried to make patient understand everything, was excellent. It's another thing that your patient was not ready for the discussion that much.
I thought that I would not be the patient. I thought maybe you are
No, ma'am.
taking.
No, she asked you.
No,
She asked you she said, "Okay,
Yeah,
take the
yeah,
call."
ma'am.
no, ma'am. Actually, poor her.
Sorry.
That's
She's
okay.
been a bit under the weather, ma'am. Yes, ma'am.
That's all right. Yeah, it'll get better, but it was good.
Inshallah.
What others think? What others think? Dr. Hana, Dr. Mohammed? Yes, it was good. I really enjoyed. And I think
Thank you, ma'am.
within the
Thank you,
given
ma'am.
time, you covered everything. So there was nothing
Thank
left.
you, ma'am.
Yes, she was excellent. Good.
I was not a
So
difficult
now,
patient.
no,
Yes,
not
you
at
were.
all. You were supposed to be like anxious and worrisome, but you were not.
Yeah.
So, okay,
It's
are
all
you
right.
ready now for history taking?
Yes, ma'am.
Okay. You want to take breathe in. All right. Starting timer.
Yes, ma'am.
And here is your question. Right. If you have read and understood, kindly begin your history taking station, please.
Hello, I'm Dr. Aisha, one of the surgical SHOs. Can I confirm your name and date of birth?
I'm John. I'm 67 years old.
Okay, John. It's nice meeting you. Can you please tell me how you're feeling today?
I don't know, doctor. I'm just not feeling well at all. And I don't know why am I here. And you know what? I just want, I don't really know. I just want to sleep.
I can see that and I can understand your concern. Can you please tell me that in which kind of complaints you're having in the previous days?
I can't exactly say you, I can't remember anything. I don't even remember what I'm doing over here.
Can you just are you happy to continue the discussion?
Okay, I can talk to you only. I don't want to talk to too many people.
Yeah, thank you so much. Thank you so much. Can you please tell me, so how you're feeling nowadays, and how do you feel? Do you find any joy in your life or any pleasure?
No, I have not. I don't know. I don't feel any fun at all. I just don't feel like living. It's just so, I'm just so frustrated with everything.
I can see your concern that you are upset. Can you please tell me, is that because you are so tired and you're not, you're so tired of your daily routine and all that?
I am actually. I am. I don't remember. I'm really like bored and I don't feel like doing anything nowadays.
Okay, I can understand that it happens sometime. Can you please tell me that how is your sleep pattern?
Sleep pattern, I don't get any sleep at all. I can't sleep at all. I want to sleep, but I just doesn't happen.
Okay, and what about your appetite nowadays?
Appetite, I don't have any appetite. I don't feel like eating anything.
Okay, and what about your hospital admissions previously?
Doctor, I can't remember anything. I told you I don't even remember what I'm doing over here. Why am I talking to you? I don't know.
Okay, I can understand that. So you can't remember anything. So can you please tell
No,
me
doctor.
where are you now at the moment,
I understand this is the hospital.
and whom you are talking to?
You're the doctor.
Okay, and what time of year it is?
2030.
Okay, and if I give you an address to remember, can you are you happy to remember that, and then you can tell me later on?
Okay, let's see. What is it? Let's hear it.
Okay, it's 3 Bardsley Green and Hutton Hospital, Birmingham. Okay,
Okay.
and so can you please tell me that who is the Prime Minister of UK?
I don't know. Who is
You
he?
do. I
You know?
also don't know.
Okay.
Okay. And can you please tell me that when was the Second World War? Do you remember that?
1941.
1941. And do you remember your date of birth?
1929.
1929. Okay, that's good. And okay, can you just recall the address that I told you?
I don't remember. What do you tell me? I can't remember. Birmingham, something you said. I'm sorry, I can't remember.
Okay, that's fine. Nothing to worry about. And so you don't remember anything about your previous presentation to the hospital?
I think I've been here before, but I don't remember when and why.
Okay, and do you have any idea what particular time of the day your mood is low?
No, doctor, I can't remember that.
Okay, and you can't remember any previous such episode of low mood?
No, doctor, I told you I can't remember anything. I just give me something so I can sleep. Just give me some painkillers or some sedatives so that I can just go to sleep.
Okay, I'll just so after my conversation ends, we'll sort it out, and I'll ask the staff to give you the medications. And who do you live with at home?
My wife?
Your wife. Okay, and do you drink?
Yeah, I do.
Can you please tell me how many units per week?
I don't know. 7, 10 glasses?
Okay, that's good. And what about your smoking? Do you smoke?
Yes, doctor, I smoke.
Okay, and how many cigarettes?
A pack every day, like 10 sticks per day.
Okay, and do you remember what do you do for a living before this, before coming here or in the past?
No, doctor, I can't remember. I'm sorry, I just can't remember.
Okay, that's completely fine. We'll sort it out, don't worry. And
All right.
okay, thank you so much. So I will have a chat with my consultant, and then we'll come back to you, and I will ask the staff to give you the medication so that you can have some nice sleep, and you can, and then we'll discuss this. Okay.
All right. Okay, doctor. Okay. Thank
Okay,
you.
can you present your case now?
So today I've been asked to take history from 67-year-old male patient who presented after excessive dose of routine medication. The patient is in extreme confusion, and with that he does not remember any past event, any past medical history, and the patient was having an EMTS score of less than 6, and the patient was in after this excessive dose. Even the patient does not remember that he has taken some overdose of medication. Previously, the patient is hypertensive, diabetic, and hypercholesterolemic, lives with his
Okay.
wife.
Considering your history taking, what is your differential diagnosis?
Uh, First, the overdose of the medications the patient has taken. Because
Yes.
of that, patient is in delirium
And
or confusion. And secondly, that the patient is in extreme depression. It's 5.
so what might be the reason behind that?
Reason behind these that they're
Okay. Do you think patient is fit to go ahead for the surgery?
not at the moment. We need to decide that the cause of his confusion first, and then if it's safe, then we can go for surgery.
Okay. What should be the management for this patient at
First
this
of all,
moment?
at this moment, I need to ask psychological concern with the involvement of the on-call psychiatric consultant, and then reporting to my registrar and consultant so that I can have further input from them. And apart from that, we need to take the routine blood investigations of the patient to find out the cause of his confusion, and and if required, then we can go towards CT scan brain as well to check the blood sugar levels, and along
Yes.
with
And
that, we should go towards the whole septic screen of the patient to find out might be in sepsis, and that can be leading towards his confusion.
okay. What else needs to be considered?
And to complete, actually, with sorry, I forgot in the start to complete my detailed history and examination of the patient as well, and taking some input from next of his skin as well to find out
Yes.
the and
And you have to consult the general practitioner
general
of the
practitioner
patient.
as well. Yeah.
Yes. Yes. Okay. So that was it. Feedback that I want to give you, that one thing that you took 1 minute extra, it should be concise. Secondly, when you were finishing it off, you didn't ask about the idea, concern, and expectation from the patient. Even when patient was saying, "I want to sleep, sleep, sleep," but still. And then in this one, it's important to emphasize that patient has acute memory loss.
Acute
And in
memory
your,
loss.
okay,
Okay.
it was AMS score was 6, but then
4.
it's acute or short-term memory loss.
Ma'am, acute delirium. Yes, ma'am.
Acute delirium and short-term memory loss, because there
Yes,
is
ma'am.
one long-term memory loss and there is one thing is short-term memory loss. So in this one, it's
Yes,
acute
ma'am.
delirium and it's short-term memory loss. And then right, and then you should know that this hernia is not an emergency. Patient can wait. First, you have to rule out if there is any metabolic cause, because in differentiation you have to know if there is any metabolic abnormality, if patient is going in like because of renal failure or hepatic failure, or if there is hypoglycemia or hypothyroidism or hypoxia or any like these sort of deficiencies, or because of medications like steroids or any other opioids or any other medications, sedative medications, because of which patient is unfamiliar of the environment and background, and patient is experiencing dementia. So that is important.
Actually, I got confused as that this station is of depression, or it is for that delirium, and so I was really confused and after reading the scenario, because it's not written in the scenario regarding his surgery.
Yes,
Yes. Operation. Yes, ma'am. You have not mentioned that operation part. That's why, ma'am.
I have.
No, ma'am. Sorry, ma'am. It's not there in this thing.
uh
Excessive
okay.
this thing.
Uh-huh.
But then But
that
then
is
again,
another
ma'am,
case. Okay.
ma'am,
Yes,
this is
ma'am.
an overlap between depression and confusion, ma'am, over
Yeah,
here.
yeah. Okay.
That's, ma'am, I wasn't able to understand that. What should I do? Should I take history of confusion?
Confusion.
Yeah.
Yes. It was like
Ma'am,
mini
so
mental test you had to do.
yes, ma'am.
But this is like patient's fourth visit. Okay, yes,
Yes,
that's
ma'am.
why. Yeah. So that one is different. All right. Sorry, I
Yes, ma'am.
myself in a hurry because I didn't know which station you would be willing to ask for. So,
It's okay,
No,
ma'am.
that's fine, ma'am.
but
Thank,
all right. Okay.
thank you for
Anyway,
the
you
feedback.
got
Yeah.
practiced. Yeah, you got
Yes,
Yes,
ma'am.
ma'am.
practiced.
Yeah, I got practice. Yes, ma'am.
So the important thing is that you ask the whole history within the given time.
Yeah, ma'am. Thank you, ma'am.
Thank you. Yes. Who else? Dr. Mohammed, in a hurry. I thought I can find, but I can't find your station right now. So it got postponed
Okay.
for tomorrow again. I'm sorry. Network is bad, it destroys whole mood. I spent so much time in logging in. I'm really sorry.
Okay, no problem. Tomorrow, inshallah.
Then yeah, inshallah, because I thought I can find it quickly because my own folder is not that much organized, and in a hurry, I'm not able to find your station.
Okay.
Yeah, maybe we can try Dr. Sundays. What would you want to go ahead with? Dr. Sunday, good evening.
Good evening.
Yes, would you want to present any station or
Okay, I can try
yes, which one?
communication skills.
Sorry?
Maybe any communication skills.
Any communication skill. Yes.
Yes.
So who would be able to help you? Dr. Fatumata, how are you feeling? Would you be able to help Dr. Sunday?
I'm much better.
Much better, that's good. Would you be able to help?
Okay,
Okay,
no
good.
problem. Just that there will
Yes.
be a little bit of noise, but that's okay.
Would you be able to, you are in, okay. Okay, I'm starting the timer. Is this noise behind you? Can you just for 10 minutes move away, please, from the noise or the music? All right. Can I start the timer? Both of you are ready? Yes? Can I start the timer?
Yes.
Yes, please. Okay. Starting the timer, and here is the question. Yes, if you have read and understood, kindly begin your
Yes.
station.
Yes. So, hello, Mr. Max. I'm Dr. Sunday, one of the surgical doctors. Good evening.
Okay. Good evening.
So I'm here to speak to you regarding the procedure you're about to go for. So do you have some moment?
Okay, sure. That's fine.
Okay. So before I dive into it, can I just ask you, what do you know so far about this procedure and about your condition?
So, doctor, I've been having like this bleeding from my backside for about 2 months now. Yeah, and then I'm told that they're going to do a test for me called colonoscopy, but I don't know much about it.
Oh, I'm so sorry to hear that. I know that must be hard for you. So, like you rightly said, so you're about to book you for colonoscopy. So what does it mean? This is a procedure whereby we pass a tiny camera, like the size of a pen, through your backside.
Okay.
So so the camera is like a tube. So it will relay the picture from your large bowel onto the screen, and we can see what is going on in there. So do you understand what I'm saying?
Oh, yes, doctor, I understand.
Okay.
So, but doctor, is it painful?
So about that, we are going to sedate you, so you can decide, because when the anesthesiologist was going to speak with you before the procedure, so it's either most people prefer to sleep, so we can sedate you and give you pain medication so you won't feel it during the procedure.
Okay.
So however, on that day, because of the anesthesia and the drug, so you won't be able to operate heavy machinery or even drive home after the procedure. So I would advise you have someone that can take you home. So, and this procedure is a day case, which means we need to admit in the morning before the procedure, and then you can go back home, that evening.
Okay, doctor. So, is there not another option?
So, of course, there are other options, like we can do some scan, like X-ray scan, ultrasound scan. However, none of these options will give us the concrete information that we're going to get from this procedure called colonoscopy. Because this procedure, will allow us to take sample of anything we find, and that sample can be sent to pathologists, and that will give us further information about what is, like you know. So part of the thing we are trying to rule out in this procedure is cancer. So, and we need a sample to send to pathology to be able to be sure whether the cancer is present or not, considering your complaint.
Okay, so you mean I have cancer?
No, it's too early to say that. However, it's part of what you are trying to rule out, and that is why we are performing this procedure to rule out cancer.
How long would it take for me to know? How long would it take for me to know the result?
Okay, so basically the result will be out within 2 to 3 weeks after the procedure. So, and we're going to meet you or call you and fix a meeting, maybe outpatient meeting, to discuss the result with you and the next step.
So you mean, doctor, I have to stay with the bleeding like that until 2 to 3 weeks?
Okay, so another thing about this procedure is that it gives us advantage of looking inside your blood bowel, and we see any source of bleeding. So there's even opportunity for us to stop the bleeding with some of the the camera is also equipped with some what do you call it, some part of it that can help us to stop bleeding. So which we can use during procedure to stop the bleeding if the bleeding is from the blood bowel where we are checking. So that can prevent or stop the bleeding temporarily. So, and that's part of what we are planning to do. And we are not going to leave you to be bleeding for 2 weeks. So we are going to control it and also do other measures to prevent that from happening while we wait. Hope you understand what I said. Or do you need me to go through it again?
Yes, I understand very well what you mean. But how about if the bleeding cannot be controlled by the camera?
So the thing is, during this procedure, there are other complications, and one of it can be bleeding also. So if that happens, then that might require further, procedure to control it. If of which
Like
is most like that, that's very rare. But if need be, we might need to perform further procedure to control it.
the same instance or another day, so I get myself prepared.
So it depends on the if the bleeding is massive, so maybe at the same instant. So I will need you to consent to that even before the procedure. So, and that is what I mean.
Okay. I guess that
So
will be
also I would like okay. So also I would like to also tell you about other complications that could arise. So other complications
Okay.
could be infection, which is most unlikely, very rare. Then we also have risk of puncturing and perforating your blood bowel, which is also very rare. Don't worry about all this complaint because you're in a good hand and you have experienced surgeon. So, however, so we are supposed to tell you because these complications could happen. So, yeah, and then other things that could happen would be maybe you having allergic to any of the anesthetic drug or feeling dizziness, after the anesthesia. So those are the other complications that you could expect.
Okay. That's
So
fine,
and
doctor.
Okay,
I would
tell
also like
about
to
the
tell you about
preparation as well.
yeah,
Bowel
I
preparation.
would like to tell you about the preparation. First of all, we are going to give you some leaflets that will contains all the information that you needed for the procedure. However, I would like to mention to you that so we need you to be admitted early in the morning on the day of the procedure, and we need you to come on that day. You can take maybe light liquid, nothing like a tea or water in the
Doctor,
morning.
what do you mean by light liquid?
Like you can take tea or fresh juice, something liquid, but not you don't have to eat anything solid in that morning. So all the solid food you have to stop a night before. Then we are going to give you some preparation, which comes in like in set, and the instruction is given on the preparation. So and this preparation, you are going to start one the night before and another one after 12 hours in the morning. For example, if you take the first one about 8 p.m., then you take another one 8 a.m. That's the morning before the procedure. That will help you to prepare your bowel, for the procedure.
Okay.
Then you make sure you afford some set of food with high fiber within 2 days before the procedure, another heavy before the procedure. Yeah.
Okay.
Don't worry, all this information is also given in the leaflet. So
That's fine.
And has to sign consent form as well.
yes, of course. So finally, so if we agree, then I will give you the form to sign, and that will be it.
Okay.
Do you have any further question?
Okay. No, doctor, I don't have any other question.
Okay, thank you for
the
your time. And if you have any further question, please you can meet the nurse. They will contact me, and then you can ask any question. Thank you for your time.
Okay, sure. You're welcome.
Thank you. And don't drink alcohol afterwards. This is like also one instruction. Okay. For this preparation, 4 days before, like stop taking iron, constipating drugs, or bulking agents. It's very important. And then 2 days before, like you have to tell the preparation in stages. Eat only eggs, cheese, white bread, butter, no meats, fruit, vegetables, etc. And 1 day before breakfast with only the clear liquids like tea and coffee and fruit juice. Yes, good. Very good. The way you explained the procedure to the patient, it was very good. It was very communicable. And yeah, I think you explained the complications as well very nicely. And what can happen if there is incomplete procedure?
Oh yeah, incomplete.
Did you
Then
say
that case they can do scan. You can do some scan, like CT scan
Yes.
with contrast.
Yes.
So
And I think you did talk about the barium enema and etc.
yes.
Because when she asked you if there is any alternative you can do. Good. Yes, he did. Good, very good. Okay, thank you. All right, okay. Anyone else has any wish to present any open station or any particular? Thank you, Dr. Sunday. Thank you, Dr. Fatima,